Ah, yes. And finally, we're being joined by, okay, so I get tongue-tied each time she's in the studio. On the left here today, we have Dr. Ola Brown. She's right here with me, a British Nigerian medical doctor and healthcare entrepreneur. Now she's going to be talking to us about healthcare on a budget. Is it possible to have more affordable healthcare for your family? Now, Dr. Ola Brown, you'll be giving us some insight into this. And I'm sorry if I get tongue-tied each time you're here, but I know you are going to do all of the talking, so I don't really need to say anything. You're welcome once again.
Thank you.
Good to have you here.
Thank you for having me again.
Yes. So healthcare on a budget, I think it's impossible, by the way. But like Mike said something from earlier, he said in Nigeria, you're one sickness away from poverty. And that is actually a very true story for most families. Mm-hmm. But how is this possible, healthcare on a budget?
So I think that healthcare, or trying to do better with our healthcare, is important. And I think in threes when I'm talking. So I'm going to be speaking about three things today. Okay. Number one, prevention, and how we can prevent these illnesses in the first place. I'll be talking about number two, the role of insurance in making our healthcare expenses more affordable. And number three, advocacy, and how we can sort of influence the agenda on healthcare. So in terms of prevention, first of all, I think, we're seeing a shift in the kind of diseases in Nigeria from infectious diseases like malaria and typhoid and diarrhea and respiratory disease, outside COVID, of course, to more lifestyle diseases. So we're seeing a lot more diabetes, a lot more strokes, a lot more hypertension. And the reason why they're called lifestyle diseases...
Because they are created by our habits?
Something like that, yes. Our lifestyle has a huge influence on developing these diseases. So diet and exercise are big factors. I saw them making, I think, talking about fried dodo earlier. Yeah. So, avoiding fatty foods, avoiding fried foods, and going for more boiled or grilled foods, and also reducing our intake of carbohydrates, increasing our intake of fruit and vegetables, and taking more exercise.
Cultural feature. That's such a cultural, because there's only so much you can take away from our diet as Nigerians. That apart from that, if you say you want to live a healthy life and with using your diet as a basis, it's going to be very expensive.
It's not very expensive, it's more inconvenient. So I'm from Ekiti, and telling people that, it might be an idea to swap our own pounded jam for, maybe an eggplant-based swallow or a cabbage swallow.
Which is more healthy.
Yeah. They're telling me that it's like eating a four and a four. That how can you eat cabbage swallow with a four again? That's like leaf and leaf together. But these are kind of healthier alternatives. Rather than having, long grain rice, maybe having cauliflower rice instead. Again, it's not as, appetizing for our palates, but I think palates adjust. And also the role of exercise as well that I spoke about. So early morning runs or early morning power walks may not be as cultural for us as they are in other parts of the world. But taking that early morning run is not just a valuable time to bond with your family, where you all go out on a run together, or you all do a walk together, or you all do an exercise routine in the morning. After morning devotion, you now do your morning exercises. But it's also a good way to keep fit and get your kids also into healthy habits that they'll take through their lifetimes. The second thing that I wanted to talk about was the role of insurance. And, 80% of people in Nigeria are still paying out of pocket for healthcare. It's a very difficult thing to do. So getting on an insurance plan can reduce the risk of having to pay so much for healthcare. And the third thing, and probably the most important thing, is the role of, advocacy as well, because no country in the world has achieved universal healthcare without the huge investment of government, right?
Government, yes, indeed.
It's the government invests. Like I hear people complain that the government is not doing anything. It's Thomas Sowell, an American economist, I think he is, that says that there are only two aims of any politician: what is getting into power and what is staying in power. And the third is very far. So if you make it, like I feel like in England, the NHS is such a big political issue that if any politician does not include that in their campaign, that healthcare, then the person is definitely going to lose. Yeah. And if you look at the American elections, Obamacare, this long care, this one, it's the second biggest issue that Americans vote on. So, of course, when you look into a politician's mindset, and number one is getting into power, number two is staying in power, then to get into power or stay in power, they have to talk about healthcare and they have to deliver on healthcare. But I don't know what the election, well, you probably worked through the election.
Well,
what are the issues that people are like, you know, the real issues that people really advocate for?
I don't know if Nigerians are actually put healthcare forward first.
But if you don't put healthcare forward, and it's not a criteria for getting into power or staying in power, then also there's a role for advocacy as well. So those three things: prevention through diet and exercise, getting on an insurance plan to reduce that huge amount of spending, and also advocating for better healthcare, making it a central issue for the two aims of any politician, getting into power and staying in power, will make it a lot easier. I mean, American politicians probably don't do it purely out of the generosity of their heart. They do it because they know when they talk about healthcare, they're going to win. But in Nigeria, I'm not sure that if you talk about healthcare,
in Nigeria,
you're going to win.
if you talk about good roads, then you're probably going to win better than if you talk about healthcare. But the problem with healthcare in Nigeria is this, and individuals, is that even when you say insurance is something that they should go by, they find it very difficult to put such amounts down that are being demanded by the HMOs. A small family, for instance, would have to pay somewhere upward of 200,000 naira per year, and these are families that perhaps wouldn't be able to afford 200,000 naira. And I'm talking about maybe even just as a couple, or maybe a small family of three. So these are very difficult times for families in Nigeria. If insurance cannot be factored into their budgets, prevention perhaps. So if you're talking about prevention, then you're talking about what we do, what we eat, how we go about our daily activities and all of that. Then there is no time to do all of that, because we're perhaps in traffic for 3 hours going to work and 3 hours coming back, apart from me, of course, because I get here in 30 minutes. But in any case, how can they weld these routines or weld these habits into their regular routines that makes it just part of their everyday? For instance, do I need to drive to work every day? Could I just take a walk half the way?
Absolutely.
Stuff like that, maybe.
Absolutely. So that's a really creative way of doing it.
Not use the elevator at work, instead use the stairs. Would that help?
That's a very creative way of doing it, just building it into your routine. But I still think that, you know, everybody has time for what is important. And I can remember, you know, having to wake up and drive to my yoga studio. So I had to wake up at like 4 a.m. to get to my yoga studio at 5:30 before going to the office.
Wow.
So I think that if exercise is important and you do make it a priority, Nigerians have time for all sorts of things. I mean, all the times that we're using to go to Owambe's over the weekend, we can now use it. Well, that's not an option anymore. We can use it for exercise. So I think that, you know, time is an issue, but we still do have things that we prioritize. And I think our health should be one of those things that we prioritize.
When you spoke about advocacy, you also mentioned that you can also include the children in this, and that's one big way to advocate that health is a big deal when it comes to our lives. Having the children start from a young age to know that this is a very integral part of living in Nigeria. So I think that's very interesting. Well, thank you very much once again, Dr. Ola Brown.